My name is Connor Williams. I am a postdoctoral researcher at the University of Adelaide with the Supportive Oncology Research Group, and I'm based here at the South Australian Health and Medical Research Institute, or better known as SAMRI, or the Big Cheese Grater.
The Big Cheese Grater, we've got a photo of it behind you so people can understand what we're saying. Well, we're talking first up about your research into cachexia. So can you explain what that is and what your research is, but also ultimately the benefit you hope it will give to head and neck cancer patients? So I think I've had radiation in particular.
Yeah, so cachexia essentially is a term for pathological weight loss, which is experienced by or in any sort of disease state. However, it's quite commonly seen in cancer broadly. And so my work particularly is focused on obviously head and neck cancer, and so chemoradiation regimens. So individuals receiving both chemotherapy and radiation therapy for head and neck cancer. And so what we are looking to do with our work is better understand who might be more at risk of developing cachexia and hopefully identify strategies to reduce it.
So in a nutshell, what is your research looking at precisely, and where are you up to in terms of its potential benefits to people treated for head and neck cancer?
Yeah, sure. So particularly we're looking at one factor known as GDF15. So it's essentially a protein which is expressed in everybody normally at a normal level. However, in cancer in particular, this factor, which is known to drive metabolism and nutrition, we know that it is highly upregulated in a number of other conditions. However, it's never been identified in head and neck cancer. And so our recent research, which is been run here through the Royal Adelaide Hospital, we found that in head and neck cancer patients going through chemoradiation, these levels are significantly increased, ultimately driving that pathological weight loss. So what we really hope from here is to explore how we can directly target this protein to hopefully improve sort of those nutritional balances within this cohort, and hopefully allow them to receive the full duration of their treatment and receive it well.
As you know, I am a head and neck cancer patient survivor, as they say. Well, I had my treatment in 2013, but to let our audience understand, in the last, I had 33 sessions of radiation, weekly chemo, and I'm pretty sure for the last 2 weeks of my treatment, I was weighed on arrival every day at the radiation bunker before treatment, and I'd been allowed to not have a tube put into my stomach for feeding or a nasogastric tube. So some people automatically get that assisted feeding. But I was weighed every day, and I was told if I got below a certain weight, I would have to be nasogastric fed. So I lost 20 kilograms in 6 weeks, but I avoided nasogastric feeding. So I'm trying to give people a sense that it's treated as a really serious potential side effect, isn't it?
Yeah, absolutely. I think there's extensive education that these patients receive upon receiving their treatment plan. It is a major focus of the clinicians and the nursing staff to really keep a really close eye, because it can be a really good indicator of how well someone is tolerating their treatment. And of course, in when the treatment is specifically targeting the oral region, it is really important to make sure that they're getting enough nutrition.
Yeah, I've just paid tribute to my dietitian, Amanda, who leading up to treatment made me eat as much as possible to put on weight, and then who watched me very, very closely. They send you lots of liquid food because you can only swallow liquids in the end. But again, fantastic if you can help us to reduce that dramatic and dangerous weight loss.